No one ever wants to hear their child cough like this. Oh, here we go. Pertussis is a disease caused by Bordatella pertussis. This bacterium is attached to the cilia that line up the part of the upper respiratory system. The bacteria then release toxins, which damage cilia, causing the airways to swell.
Initial diagnosis of Bordatella pertussis can be difficult. Symptoms usually exhibited are those that of flu-like and bronchial complications. So the three common methods of diagnosis are going to be your nose and throat culture, your CBC or blood test results, or an x-ray ordered by the doctor himself. But with the nose or throat culture, they are sections taken from the nasopharynx, swabbed, and they're checked for their exact bacteria of the Bordatella pertussis.
Before the vaccine, pertussis used to be one of the most prevalent childhood illnesses, and at this we saw a 10% death rate. In the 1940s, before vaccine development in the US, per year we were seeing approximately 200,000 cases, but after the development of said vaccine, we saw a decrease in these numbers by 75%. Nowadays, pertussis, according to the World Health Organization, is responsible for the disease causing the most preventable deaths worldwide. So the reason why we're seeing these increase in numbers as far as the most preventable deaths is because we see people not getting vaccinated for one, but also we are starting to see mutations in the bacteria that a current vaccine is not able to keep up with. But there are still many reasons that a person should still get the vaccine, which we will be moving on to. The vaccine itself is able to also help decrease the severity of the symptoms associated with whooping cough. If not vaccinated or if it was not effective, then antibiotics are still available as well. But for this disease in particular, it's really good to try and treat it as early as possible. So for individuals who are over a year old, it's best to get the treatment offered within 3 weeks. And if the person is younger than a year old, or if they're a pregnant woman, then we like to see them get treated within 6 weeks.
Early stage symptoms express themselves as cold-like symptoms, such as runny nose, low-grade fever. In babies, they can exhibit apnea, which is a pause in the child's breathing pattern, and one can also see mild occasional cough. As for later stage symptoms, they occur after 1 to 2 weeks after initial exposure and include violent fits of coughing followed by a loud inhalation whoop sound. Extreme coughing can lead to vomiting and exhaustion.
Pertussis or whooping cough is an acute infectious disease caused by the bacterium Bordatella pertussis. Outbreaks of pertussis were first described in the 16th century, and the organism was first isolated in 1906.
In the 20th century, pertussis was one of the most common childhood diseases and a major cause of childhood mortality in the United States before the availability of pertussis vaccine in the 1940s. More than 200,000 cases of pertussis were reported annually. Since widespread use of the vaccine began, incidences have decreased more than 80% compared to the pro-vaccine era.
As far as outbreak control efforts, considering Bordatella pertussis, there are two main goals. The primary goal of pertussis outbreak control is to decrease the amount of disease and the amount of deaths among babies. The secondary goal is to decrease the amount of diseases among people of all ages.
Pertussis or whooping cough is a common disease in the United States. In Arizona, the last peak was in 2013 with 1,441 cases. A large community-based outbreak in Mojave County also contributed to the case counts in 2013. This outbreak was an isolated community that had a large number of individuals opposed to immunizations. Maricopa County had the largest number of cases with a total of 60% during 2011 to 2015. During this time frame, Mojave County had the second largest number of cases, with 746 cases that occurred in 2013.